Well, thank you very much. I'm just going to make sure that I've got this microphone the way it needs to be. Can everybody hear me? Yeah. Oh, good. Okay. So this is always one of the best moments for me because I get to come up here, see all of your faces, and say thank you. So thank you for coming. Thank you for supporting us. And thank you for being a force for freedom around the country and in this world. Because if you're coming to this event, you probably prize freedom, and there's probably things that you do at your home and your places of influence to try and restore and preserve freedom in this country. Our organization, Citizens Council for Health Freedom, is dedicated to keeping America and its patients and doctors free. And we appreciate your dedication to us. Since this is our once-a-year fundraising dinner, please do not let the silver bag in the middle of your table go unnoticed. I aim to use my time tonight to make clear why your financial support is so essential, not just for us, but for you as we go into 2019. But first, I want to thank each one of our sponsors and the donors who made this night possible, our cast and crew of volunteers, the physicians who are here from the Wedge of Health Freedom. There were two, I hope you met them. The organizations with display tables, our event coordinator, Barbara Smith, our exceptional board of directors, the hardworking CCHF staff who helped make this event run smoothly, and Bob Davis, our wonderful MC. Thank you. And thank you to Dr. Keith Smith, our keynote speaker. I think you'll love what he has to say, and I'm looking forward to it. Thanks, Keith. I also want to recognize the legislators, candidates, and officials in the room. Please rise and be recognized wherever you are. I know there are some of you here. Okay. And I'm pleased that several physicians and nurses are here tonight, as well as students from the University of Minnesota, and thank you all for coming. And last but not least, join me to give a warm Minnesota welcome to a couple who drove all the way from Texas. So wherever you are, Susan and Randy, there they are. Okay, now it's time to get down to business. As an organization committed to patient and doctor freedom in a country racing towards socialized medicine, we have much work to do to stop it, and you are essential to our efforts. There's a lot at stake, a lot more than you might know. I was talking to someone from the Physicians Foundation about their latest survey results. Nearly 61% of more than 8,000 physicians surveyed say they are planning to cut back hours, retire, find a non-clinical job, or work part-time in the next 3 years. 61% in the midst of a physician shortage. If just the 17% that plan to retire leave, there will be 130,000 fewer doctors in the next 3 years, while 10,000 baby boomers enter Medicare every day. I told him the public has no idea that the practice of medicine is in crisis, that doctors are disappearing in droves, and he, a physician, agreed. In fact, many are leaving because outsiders decide if and how much they get paid. Outsiders limit their treatment choices for you, the patient. And every day, their put the patient first principles are challenged. So what would a healthcare system be like without doctors? You see, no one else who walks into your exam room has medical training. A nurse like me has nurses training. A nurse practitioner has advanced nurses training. A physician assistant has 2 years of training to assist a physician, not be one. Only physicians have medical training. Only physicians are trained to do differential diagnosis, which is critical to your healing. And only physicians can be surgeons. They are the only ones with 11 to 17 years and 15,000 to 20,000 hours of clinical training under their belt. But nobody has to be a doctor, and nobody has to stay one. Doctors fed up with government reporting requirements, following other people's orders, health plan interference, and being paid for value instead of actual services, time, expertise, they can find another job. They're smart people. Another job that's kinder to their conscience. Dr. Tom Davis told Medical Economics that he left his 25-year practice and 3,000 patients because of the demands of data entry, the use of this data by outsiders to direct his treatment decisions, and his overall uncertainty about how medical data was used. He didn't feel he could ethically continue to practice, so he quit. Our organization exists to protect the freedom of patients and doctors who are getting a very raw deal in the transition from the charitable practice of medicine to the calculating business of healthcare. But our goal is bigger than just the patient and the doctor. As goes healthcare, so goes the country. If someone has the legal authority to tell you when you can live and when you must die, you are certainly not free. Greg Scanlon, our newest board member and the only one not in Minnesota, told us that CCHF is the only organization in the nation lobbying for patients. He may understand this more than most. He used to work on healthcare issues for various conservative think tanks in and outside of DC. Our focus is the patient and the freedom necessary for medical excellence. The only reason we have a doctor, the only reason we have a system of medical care is because we have a patient. So if the system is being used to the detriment of the patient, and the system is forcing physicians to violate their moral code and prioritize something other than the patient is in danger. Today's healthcare system, where the business of healthcare has taken over the mission of medicine, was put in place by Congress. I wrote an article as, that's so funny, I've just forgotten the MC's name, Bob.
That guy.
That guy, yeah, as that guy said. I wrote an article about it called Blame Congress for HMOs, which was published in the Congressional Record of the US House. Senator Ted Kennedy, just so you know, Senator Ted Kennedy used the HMO Act of 1973 to impose HMOs nationwide. Hillary Care would have relied on these HMOs to run the national healthcare system. Congress is now pushing senior citizens into Medicare Advantage plans, which are HMOs. And Obamacare essentially prohibits anything except HMOs, which you now know as health plans, like United Healthcare, Medica, Health Partners, and more. So if we succumb to socialized medicine in America, it'll be run by these health plans, the managed care corporations that control doctors and collect billions of taxpayer-funded premiums through lucrative public-private partnerships and government contracts. For example, since 2009, the year before Obamacare, United Healthcare's stock has risen 1,400%. And these health plans will still have the legal authority Congress gave them to deny patient access to care. That's why health plans are not private insurance. They're the corporate version of socialized medicine. Ted Kennedy knew exactly what he was doing in 1973. These health plans are dangerous to patients. The bureaucratic busy work imposed by these self-serving corporations has disrupted and hampered the mission of medicine. The rules, the prior authorizations, the retroactive utilization review, the drug formularies, the CPT codes, the quality metrics, the government reporting, the MIPS, MOC, PQRS, the threat of financial penalties and withheld payments, and the constant clicking of checkboxes in the government-designed electronic health record. These all focus the doctors' and the nurses' attention on data points and documentation rather than the patient's story, concerns, and condition. This busy work of healthcare is why studies show doctors spend twice as much time inputting data into the computers as they spend with patients. It's why John's doctor sent him a letter telling him to find another doctor. His continued high blood pressure and high blood sugar levels hurt the doctor's quality metrics and threatened his reimbursement levels. So John was dismissed because he wasn't healthy enough. It's why Mary's physician argued with her when she wanted the scribe out of the exam room during her very private gynecologic exam. Her doctor wanted the scribe in the room charting the visit, but Mary didn't want him watching. This busy work is called the business of healthcare, and it has nothing to do with the mission of medicine. And because the business has taken over the mission, patients face unaffordable prices, nonprofit tax-exempt hospitals charge whatever the market will bear, the uninsured have to pay prices multi-billion-dollar health plans never pay, and sick and injured patients are too often more afraid of the cost of care than the medical condition they face. Dr. Victor Montori, a physician and researcher at the Mayo Clinic, says, "We have a healthcare industry that has corrupted its mission and stopped caring." Indeed, at its core, the mission of medicine is and has always been about putting the patient first and being kind, caring, and charitable. But today, the system in which medicine is practiced does not care and is not charitable. Instead of serving patients, it takes advantage of them for its own purposes, financial purposes. As Dr. Montori warns, money will displace the patient in what matters most. Some doctors find it easy to still be charitable. For example, Dr. Madrigal in Texas runs an independent cash-based practice. Her patients pay her directly, but when one of her patients gets cancer, she lets them come free, ever after. She is kind, caring, and charitable, and she is loved by her patients. She can be that way only because she's her own doctor. The business of healthcare, third-party payer requirements, government regulations, and mandates can't touch her. She's free to care deeply and to give care freely. This is what we all want, because whether you're rich or poor, your independence goes out the door as soon as you put on that hospital gown. You want skilled professionals who are caring and trustworthy, working in your best interest when you cannot help yourself, when you cannot speak, when you cannot move. But 55% of working physicians say they are burned out. For many, this means their joy, enthusiasm, and empathy for patients is gone, snuffed out by outsiders trying to control their treatment decisions, assembly line medicine, productivity quotas, and mountains of bureaucratic busy work that distracts from patient care. For some, the pain is unbearable. About 4,000 physicians commit suicide each year, and many of them cite inhumane working conditions in their suicide notes. But with enough size and clout, some doctors can resist the takeover of their practice. A local group of neonatologists has refused to become hospital employees and will soon leave Children's Minneapolis Hospital because they don't want the hospital administration controlling how they take care of premature babies. But at other institutions, physicians are simply being replaced by non-physicians as though they were equivalent. Some hospitals are even using non-physicians as hospitalists, putting these practitioners without medical training in charge of all the patients in the hospital. And this is why it's so important for you to be here tonight. Citizens Council for Health Freedom is working strategically and with determined persistence against the takeover of the healthcare system, whether by corporate interests, government dictates, or the lucrative public-private partnerships that health plans have today with government programs. I know, government agencies, Congress, legislative leadership, and the healthcare industry are huge. They're much bigger than we are. But how do you topple a big tree? You chop away at its foundation. The smallest of axes can topple the largest of trees. So don't look at the size of the tree. Look at the determination of those holding the axe. And that's us. So let me show you where our axe is striking. First, we're the only organization in the entire country that is focused like a laser on the surveillance infrastructure critical to imposing socialized medicine. This is because we know he who holds the data makes the rules. Every tyrant, every dictator from Russia, China to Iraq knows this, and so do we. I feel certain that our nationwide efforts to expose the HIPAA privacy myth will ultimately bring the repeal of the HIPAA no privacy rule and the restoration of patient privacy and consent rights over how your data is shared and used. We're also using Big Brother in the Exam Room, The Dangerous Truth About Electronic Health Records. This is the book that I wrote, which was just released in July. And we're also using our contacts in the Trump administration. All of this to move the needle back to privacy, consent, and patient and physician control of medical decisions. If you buy the book, do not miss the section on HIPAA. It is meant to permanently get rid of the idea that HIPAA has anything to do with privacy except getting rid of it. Because that's what HIPAA does, it gets rid of it. And don't miss the section that has action steps for Congress, state legislators, physicians and clinicians, and patients and citizens. There are 4 separate lists. Second, our axe is striking at the financial foundation of Obamacare. Using our nationwide Health Freedom Minute radio program, we've been giving Americans alternatives to Obamacare, all found at refusetoenroll.org. We're encouraging them to take their coverage dollars elsewhere, such as to health sharing organizations. And in the last 4 years, health sharing membership has skyrocketed, providing Americans with an affordable, personable coverage option they'll want to keep forever. They'll never go back to health insurance. Third, our axe is pressed hard against the Clinton executive mandate that forces most senior citizens into Medicare at age 65. I'm pleased to report that we've captured the attention of top-level people in DC. Our bill to allow seniors to receive their Social Security benefits without enrolling in Medicare was introduced a few weeks ago. A nationwide petition to President Trump is in the works, and you can pick one up on the back table as you leave. And we've engaged other organizations across the country who will work with us to pursue this critical initiative. It is essential that this be done while President Trump is president. Because he can take action unilaterally, and he is a president willing to do so. This is not a law. It's not a law, it's not a rule. It was something the Clintons put in by a simple executive instruction, and the Social Security Administration has been following it ever since. So he doesn't need Congress, and once Americans can't be forced into Medicare, imagine how this will disrupt all plans to impose Medicare for all. So that's some of the ways that our axe is chipping away. But there's another way that we're chipping away, and that is we're building. We're building an alternative infrastructure of freedom for patients and doctors. In 2016, we launched the Wedge of Health Freedom to draw doctors into direct patient private relationships with patients and to help them find each other on the web. Jointhewedge.com. These doctors are free from government and free from the government's health plans. They sign no contracts with anyone but the patient. Nearly 300 practices nationwide have already joined the Wedge at jointhewedge.com. 2 of these practices are here tonight. Our aim is the end of managed care. Ted Kennedy put health plans in place to centralize and socialize healthcare, and our goal is to force them out of business or to turn them into honest indemnity insurance companies. The kind that don't interfere, don't have networks, don't limit choices, but simply reimburse for major medical expenses. They simply set reimbursements for major medical expenses. One man, probably in his 80s, told me that back in the 1970s, he had heart surgery, and his insurance company, a indemnity insurance company, sent him a check for $68,000, which he used to pay his doctor and his hospital. He said, it was simple. Yes, it was. And it was inexpensive because there wasn't a health plan. So it can be this again, and we are intending to take it that way with the Wedge. We're also building new coverage options. We're working to encourage pre-birth insurance policies that parents can buy and hand off to their children at maturity. These individually owned lifelong policies would go a long way toward ending the pre-existing conditions that happen during employment or while on a family policy. And we've got 2 initiatives we'd like to make happen. One is a special website to help protect patients 24/7 in the exam room and in the hospital while this profiteering system is still in place. And the other would use various new media to simplify and explain healthcare so Americans don't throw up their hands and get snookered into thinking single-payer Medicare for all is simple, cost-effective, and the compassionate thing to do. Imagine if we had a communications director to develop videos, social media, podcasts, events, and more so that we could take this educational message to the nation in the media of the day. Citizens Council for Health Freedom is undaunted by the challenge to stop a single-payer, socialized medicine system and to free America's patients and doctors from those whose only mission is money and power and control. But we can't do it alone. So please, think about how much it means to you to have a physician in your future, an affordable health insurance policy in your pocket, and a trusted patient-doctor relationship in your life, one that is kind, caring, charitable, and protective. I'm asking everyone in the room to give, whether it's $5, $50, $500, $5,000, or $50,000. Your donation tonight is critical to our success. It determines how far we can go. Whether you donate by cash, check, or charge, just put the envelope back in the bag and we'll pick them up at the end of the night. So someone please pick up the bag and just start to pass them around, filled with envelopes, pens, and response cards. So now I'll say one more thing while you're considering your donation. We've sold almost 1,000 copies of Big Brother in the Exam Room. And just last week, we ordered a second printing. The book has been #1 on the Amazon bestseller list at least 3 times so far. I wrote it to enlighten, to empower, and engage the American public. I made it eye-opening and eye-friendly. It's easy to understand according to non-medical folks who have read it, and I used more than 1,500 endnotes for credibility. So please, buy Big Brother in the Exam Room, The Dangerous Truth About Electronic Health Records. You can find it at bigbrotherintheexamroom.com or buy it on your way out tonight. May I encourage you to buy several copies. And the reason I say this, yes, they're right back there. And the reason I say this, because I want you to give one to your doctor. And I want you to tell your doctor to put it in an exam room for patients to flip through. And this is a book you can flip through. Even the publishing manager said, wow, you can just look at all those titles and pick one that you like and find out something new and then go on to the next one. So I'd also like you to give one to your local library, and I'd like you to give one to your state legislator, and if you want to, send one to Congress too. So you can help us spread the word so we can put a stop to socialized medicine, because what do you need for a national healthcare system? You need a national data system to control the doctors. Without the data, they can't control the doctors, right? So help us help you to stop a socialized medicine system in this country and to make sure that you have a doctor in your future when you need one. Help us make our axe bigger and our swing stronger. Thank you so much for coming tonight.